Welcome, everybody. It's Elizabeth Walters with Live with the Hive, sponsored by HiveNurse. We're really excited to be here today. Unfortunately, Dr. Kellish is unable to join us, so it's just solo. It'll be fine, I promise. I'll try not to be too doom and gloom. We have with us Rhoda Summers, who is a very exciting guest who's trying to sort of shake up the way that we do things with preparing practice-ready nurses. She has some really great insight into that first-year new graduate experience, and we're really, really excited to have her today. Rhoda, would you like to introduce yourself and tell us a little bit about your business and your nursing history?
Okay, well, I have done almost anything you can think of in nursing. I came out of nursing school and went straight to med-surg. What else would you do? And then I just sort of went all over the hospital. I did peds, I did oncology, I did ICU, subacute. I told the people in ICU, I'm not an ICU nurse. Please don't ask me back. I don't want to go there again. Subacute was better, but still way too much information. Give me my med-surg. And I eventually went to long-term care. I know, everybody go boo-hiss. But you know what? I loved it. And then there was the time when I had a surgery go bad and I couldn't lift, and I still can't for various reasons. So can't lift, can't work bedside, can't really do anything in the hospital or nursing home. So I came up with my own job. I made my dream job. And I started by teaching nursing students how to pass the NCLEX. But let me say
so important.
Let's say that I don't do it the way everybody else does it. I am not YouTube. I am not Archer. I'm just not. I believe that you are an individual, and I should make your NCLEX experience individualized to you. How you learn is how I teach you. If you have a problem and we can't seem to get you to understand it, then I teach you the way it sticks.
Your focus sort of to work specifically with nursing students and brand new students sort of like unfortunately happened because of having to leave the bedside. What is it about that particular group of students or that particular group of nurses that attracted you to helping with NCLEX Prep?
You have to go back to when I was a brand new nurse. My entry into nursing was not good. I ended up in the hospital in an anxiety attack because of how I was treated. And I think about that almost every day, and I just think that's not right. I should be able to start out wherever I want and have a chance to be a nurse. And that's my passion now. Every nurse should have a chance. It doesn't matter which hospital.
Yeah, I mean, that's like basically the polar opposite experience that I had as a new grad. I've been a nurse for almost 25 years, and I got into a system that had just started a nurse residency program. So we had a very specific orientation with a very specific layout of how our preceptors are. What are you seeing? I'm assuming that you didn't have a nurse residency program when you were a new grad. What are you seeing now with the challenges of students who get into a nurse residency program versus those who aren't?
Okay, first off, you have to understand I have nothing bad to say about nurse residency, except for when the student hasn't passed the NCLEX. It is the only time I tell students not to do it. And usually by the time they end up in my lap, they've already done it, they're in it, and they need to pass because they didn't pass the first time.
Right.
And they, you know, when you sign on the dotted line for that, you don't realize you might not pass.
Right. Yeah, totally.
And then you don't realize how much that paycheck is going to change. Or maybe you do, but you don't realize how much of it you're going to eat up. I have had
Right. Right.
students that if they failed the NCLEX the second time would literally lose everything they had because they'd spent all their money and wasn't going to be able to pay for it after if they failed. So
Right.
that's
And
the
so you're
only
talking about like retention or recruitment bonuses and them having to pay back recruitment bonuses and
right.
all the things.
Yeah.
Yeah, it's a
It's
huge problem.
so, and then as far as nurse residency, knowing what they're getting into, I think it is much better. But again, I've had students and nurses that have had a preceptor that was really, really bad on that, and that made a difference. But um, I'm hoping the hospitals figure this out. I'm making a pretty large stink.
Yeah, yeah. Yeah, totally. Of me and Ashley's partnership, I'm the doom and gloom, and she's the rainbows and butterflies. So, you and I probably have a lot more in common. Yeah, totally. What do new nurses tell you, like your clients tell you that they're most afraid of in those first few like weeks, months on the floor?
Having somebody to talk to and know they're safe. I don't know how much of my stuff you've read, but I actually had a student who, in the first 2 weeks of working at a hospital, the other nurses on the floor started teasing her about her hair and the way that she was performing. And by the end of 2 weeks, because of their consistent teasing her, she cut all her hair off, except for an
Oh,
inch of it. Um, when she finally came to me and I saw what she'd done to her hair, I said, if you ever feel like you have to do something to yourself again to be accepted, call me before you do it.
right. Yeah. That is a terribly awful story to be bullied into
Yeah. And
a
then,
situation like that.
yeah. And then I had another one who was calling out unsafe practice, which is exactly what we teach them to do. But in real life, they don't want them to do it. And
Absolutely. That's actually one of my next questions. So like the new nurse who is seeing something wrong but afraid to speak up, how common do you see that? How often are you seeing that with your students?
it's almost an everyday thing
And what
because
kind of advice do you give the students when they call something out or they're being bullied or retaliated against?
I tell them to stand their ground because they're right, not because I want them to lose their job or I want things to happen to them. I want them to stand their ground. They're right. They know what they're doing. They know what's safe and they know what's not safe. And that's one of the things in the NCLEX side that I do. I make sure they know what is a safe assignment and what is not a safe assignment. I mean,
Right.
students call me all the time and say, Rhoda, I have 10 students to everybody else's 4 or 5 and nobody's helping me. And I said, well, are they totals or do you have a bunch of independents? And she would say, oh no, I have more totals than I do independents. I have ones that require a lift to get into the chair. It's unreal the assignments they get. Or if they're in ICU, they get, you know, 3 vents together. And I'll go, that's not safe. You can't do
No.
that.
Absolutely, absolutely. So what kind of advice do you give, your new graduate nurses when they come to you and say, oh, besides like stand your ground, but like, what are some like tips and tricks for new graduate nurses who are in that experience where they're like, I've been assigned 3 ventilators and I know that that's not safe. How do you tell them to handle those situations?
First, I make sure that they have told the supervisor that it's an unsafe assignment and that they believe that they should not accept it. If they're pushed into taking it, then I tell them to look around the unit and try to find a nurse that looks like they would help them and get someone to help them take care of that third patient. If she's taking care of 2 and keeping an eye on the third, the other nurse could take over when she needs her to.
Yeah, we in one of our previous podcasts, we interviewed a new graduate nurse who is experiencing some of that behavior, and she referred to looking for trusted adults on the unit and looking for those people who can be that resource. What are some things that you recommend to new graduate nurses in finding those trusted adults?
If you've done some of my reading on my blog, on my website, one-on-one tips, or you've done reading on LinkedIn by me, just recently I put up about this subject, and I have told older nurses to be out there looking for the new nurse who needs help. It's going to be easy. All you have to do is look at the eyes and see the overwhelm. And I specifically called out ICU. ICU nurses, you're the ones that really need to pay attention. Does that new nurse need help? And then I tell the new nurse, I've told the older nurses to be looking for you. So if you see one that looks like she's going to be friendly, ask.
Absolutely.
It,
So it's a lot about body language. It's a
mm-hmm,
lot about looking for that acceptance and reading the nonverbal cues.
right. And understand that when you go and you ask for help from that older nurse, you're putting that older nurse at risk for being bullied also.
Absolutely.
So that's the reason I tell them to make sure before they ask that they've read that body language, that they know that she wants to help.
Yeah, I totally agree with that. Like you're constantly having to read the room and I'll share just a quick story about when I was a new nurse, not a brand new nurse, but when I was new to a unit. I had been a nurse for about 8 years, and the only way I knew how to make friends was to work. And it didn't have to work at the time, but I was like, I got to go make friends. So I took a per diem role because I wasn't able to commit to 3 12-hour shifts because we didn't have childcare and all the things. And so I'd been an experienced ICU nurse for many, many years and came onto this unit and was just really wanting to get to know people in the area. My husband and I moved multiple states away. And so I was like, yes, this is going to be it. These are going to be my best friends. And the understanding in their unit or their culture in their unit was that per diems were just sort of like bodies. They were not sort of part of the team. They were just here to fill holes. And so I felt that, like I felt that hard, and it was really, really difficult. They chased me away after 3 months. I was like, I'm finding a new job. I want to find a team that wants me and that I want to work with. And it was really hard to find those sort of trusted adults or, like the people that you would normally go to in my previous units and the previous hospitals that I worked at, like the charge nurse, like the nurse 4, the nurse educator, were totally dismissive of me saying like, hey, these are my skills. I would love to be able to do X, Y, and Z, or, nobody even learned my name. Like, they called me the per diem. They were just like, "Oh, the per diem will take care of that," or "The per diem will do that." So what kind of advice would you give to nurses that are not necessarily new to the hospital system, or not necessarily new to, being a new graduate, but in, like, that situation where you know what you need to do, and you know how to be safe, and you know how to practice, but you're just in this new environment?
And they're not being helpful, or they are being helpful.
Not being helpful. No, like, and not learning your name and not showing you where the bathroom is and not telling you where the cafeteria is
So
and
one of
not
the
helping with
things
the unit protocols.
one of the things I learned very early after that nervous breakdown was that I had to be the one to become the friend. And how do you become a friend? You help out when they least expect it. So you're walking by and one of their lights is on and you see they're in a room, you go in the room and it's something you can do. You pick it up and you do it. You don't even
Yeah.
say, "Hey, I did that for you." You just do it. And you
Yeah.
keep
Yeah.
doing that. Eventually, people have to come around and say thank you. Um, and when you really get them out of a hole, and we both know that we all get in holes all the time when we're on the floor.
Yeah, you just can't predict what's gonna happen. Like, you think it's gonna be an easy assignment, then one of your patients started becoming septic, and your whole life changes in that moment.
Right. So we all know we're going to get in a hole. And when they get in the hole, you step in and you help them then. And then all of a sudden they realize who was doing the helping all along.
Right.
And then you
Yeah,
suddenly are their best bud because you did what you needed to do to get a friend. And that's what you do.
absolutely. Yeah.
Um, Unfortunately, some of the new nurses get bullied even while they're doing that. And so that even makes it harder. I'm not saying that that is going to work every time, but it's pretty close.
Yeah. Yeah, and totally, like, the concept of finding somebody that's, like, not related to the unit or the work or the hierarchy to be your safe person. So having these, like, coaching services for new graduate nurses is so important. I mean, our whole goal is to not have people burn out after 3 to 5 years, right? Like, we want
Right,
people to have a long career in nursing, to be satisfied with their work and things like that. So I think the service that you're providing is so meaningful, to those new graduate nurses, like to have that 15-minute coaching session. Like, I'm not employed by the hospital. I don't have any stake in the game of whether you're going to be successful or unsuccessful. But I'm here to provide that advice for you as, like, a third party for
and
sure. It's super important.
part of the time, Elizabeth, it is so hard, as far as I'm concerned, to explain to the nurse that they're going to need it. I'll tell them they're going to need it. I'll tell them why they're going to need it. And it's like the NCLEX. They know they have to take the test. They know it's hard, but not until they take it the first time and fail it do they know they need help. So what
Yeah.
happens with the new nurse is she gets hired on that unit that she was questioning, and then turns around and says, "Oh, I've got myself in a hole. Who can I go to?" And she tries the clinical educator and she pushes her off. She tries the charge nurse and she yells at her. So then she's going, "Okay, who can I go to?" And then they suddenly go, "Oh, wait a minute. My tutor that taught me how to pass the NCLEX said if I needed help to call her." And
Yeah.
that's how I get the call. I don't get the call before they go to take that
Of
first class.
course not. Yes, yeah. That's total logic, right? Like, it's like, but having the door open, and I think, like, having those spaces where for those of us who are more experienced, to have that door open and be like, "Hey, I'm here. I'm a third party. I teach in, uh RN to BSN program, and I also teach in a DNP program." And it's like, hey, I'm that person, like, they're paying me to be here to help you with your problems. Like, you don't have to just come to me for your DMP project problems, right? Like, if you're having an issue with your boss or leadership or applying for a new role, like, that's what I'm here for. So leaving that door open, I think, is really, really one of the key steps that experienced nurses can do to help with this like burnout situation and under in new nurses. I have one more sort of set of questions for you because this is something that you write about in your blogs and in on your LinkedIn. But the importance of that patient side, and I think that your call to experienced nurses is right up that alley. So we talk a lot about nursing burnout, and you're intentionally naming the patient costs. And why is that connection so important? Why should we care as consumers of healthcare?
Because if the patient doesn't get the help they need and they have to go back again, eventually we're going to be paying for it.
100%.
Especially if they're on Medicare or Medicaid, we're going to pay for it.
Yeah, absolutely.
And everybody says, well, the hospital will pay because they'll lose a nurse, and that's a lot of money. The hospital has a lot of money it can lose. It doesn't help. It doesn't affect them to lose a nurse, but it does affect the floor. I don't understand why you would push away somebody that's going to help you take care of the patients that are on the floor. And most of the nurses that I know that came out to be nurses want to take care of people. Why are you
Absolutely.
setting them up? You're,
Yeah, for
you're
sure.
setting them up to not get the care they need, to not get the education they need. And I'm going to blow for my thing on Leapkin this week. I have a newsletter. It's called Fix the Floor, and it is all about the empty bed, the educational folder laying on the table, and a call light. It's all about the patient left before we taught them. The patient left before they turned septic. The patient left. They're out in the community. They're still sick. We're supposed to be taking care of them, not setting them
Absolutely.
out there. And we did it because we just didn't want to deal with the new nurse. Well, get over it. Deal with the new nurse. You need
Yes.
that nurse. Oops,
Yeah,
sorry.
every team member is important. All right, my very last question is, you are a very experienced nurse. What do patients sense when a nurse is overwhelmed, even if nothing is like, quote, going wrong, right? Like they're not coding, you're not calling a rapid response, etc. What do you think that patients are sensing?
That the new nurse is first, they sense the overwhelm just like we do. And then they wonder if that overwhelm is going to affect them. Um, if you have a nurse, I'm not even going to label it new. If
Right.
you have if you have a nurse and she's so busy she can't go pee, or she can't take care of herself, feed herself, there is a point at which that will affect my care.
Yep, that's true.
And they're
That's
not
so
going to be
true.
comfortable. They're going to be the patient in the bed that's squirming, that's getting up and taking more walks than they should, or hitting the call light more than they should. It's because they're scared. We
Right.
have to do
Or the
better.
opposite, right? Like, or the opposite, like, oh, I don't want to bother her. Like, I'm in the South. So we have true Southern gentlemen here. And, oh, she seems overwhelmed. I'm really in pain, but I'm not going to bother her. I'm tough. I can tough it out. And then not getting like decent pain control and then getting to the point where they're like, 10 out of 10 pain. So yeah, like both sides, like either I'm going to overwhelm them with every little question, or or I'm going to let them do their thing. They seem too busy to bother about me.
Yep.
Awesome. Well, this has been really helpful. We love, love, love having guests. Everyone, check out Rhoda's Fix It Now series in LinkedIn. Really, really helpful, like tips that you can do to be that nurse. And I love that she's specifically calling out us experienced nurses because we are responsible for the future of nursing. So appreciate that so much. Remember, we are HiveNurse. You can receive continuing education for listening to this podcast and reflecting on it and doing a short quiz on hivenurse.com. We also are active on our social media, so follow us on Instagram, TikTok, YouTube, and LinkedIn at HiveNurse. We really, really, really want you to follow us, so click and follow. Subscribe to this podcast for more. We drop about 2 a month. Really, really looking forward to meeting you in the Hive. Thanks for joining us live with the Hive. Bye, everyone.